Okay, so what we're going to do is continue on looking at lateral hip pain. So last time we looked at some of the different causes that there could be, and I want to pick out two. We're going to look at the bursa and what you can do, and also the tendinopathy. They have slightly different ways that you'll be able to pick up maybe which one it is that you've got. And I want you to sort of get an idea of how they might respond to treatment and what you might need to do, so we can get you on the right path. As always, the best way forward is really to get somebody to have a look at it and really define for you what you need to do. But if we look at the bursa first, the bursa, so if we're standing up, we're looking at that bone, that's the lateral part of the hip. It will be tender to push on. It will be tender at night, sleeping on that side, and you may find that the skin's a bit red and a bit swollen over the top of it. So that's kind of going to be a localized indication that it's probably a bursa issue. It's going to be sore, problematic after exercise, after activity. So it could be walking up and down hill, can particularly load that area more, because the tendon is what's creating the pressure on the bursa to create your pain. Things that settle it down, ice is really effective, so that's a really good way to see if it settles down and calms with that. That's a really good thing to do, and a good indication that bursa is the problem. The secondary thing that it can respond to, well, obviously we've got to change the biomechanics, which we'll have a look at in a second, is it can respond very well to an injection. So if it's something that's nagging and stays around for a while, an injection is a good way to go. So let's look at the movement faults that we might see. And this is a really easy test to do at home. Just stand in front of a mirror, line yourself up, foot nice and straight, and just onto one leg, just do a small knee bend, and just have a look at what happens to your hip, your knee, your foot alignment in the mirror. If you find that your knee comes into that midline, you're going to stress through the tendon that loads on the bursa. You're also going to stress the tendon of the glute med, which is the other area that can cause you problems. The other thing to look for is what happens to your hip. So as you come down, some people will tend to drop out to the side. So again, that can be creating the same pressure on the bursa or loading of the tendon. So that's the bursa. The tendon, the glute med tendon sits higher, so your pain and ache will sit higher up above that bone. You won't have any of the redness. It'll be a bit tender to press on, but it certainly won't respond to ice. It will build over the course of the day, so you'll probably find it a bit stiff in the morning, but then generally you feel quite good over the day. As the day wears on and you load it more and stress it more and do more exercise, you'll tend to find it'll get irritated, and it'll be more of a slow, dull ache that will just hang around at a low level. Irritating, but not necessarily stopping you from doing anything. Much more complex to deal. We need to address the movement faults, but we need to make sure we start some work to get the tendon loaded again properly. So the area to work on here is isometric, so static loading of the muscles. So lying down on your side and just holding the leg very low. It shouldn't be painful, but just to start to load that muscle tendon area, and then you can work from there. If you've got a tendinopathy you suspect you have, I really think you need to get in and see a physio, make sure they get the diagnosis and get you on a really clear pathway. There are a lot more facets that are involved in getting you to the right place, and it will take longer. Unfortunately, it's a much more complex issue to resolve. But I hope that helps. If you've got lateral hip pain, you've got a little bit more of an idea of what you need to be looking at and where to start, and make sure that you get the right advice if it's tendinopathy to really get that settled down for you.